channel and the potassium channel here at rest, and then right here at threshold, that M gate springs open. And we're going to be in that configuration until someplace right here, and I can't specifically ask you where because it's different for different cells, but that H gate on the sodium channel is going to slam shut, and the N gate for the potassium channel springs open. And that will cause the beginning then of the repolarization phase. And you can see that sodium channel is closed, potassium channel is open, and then we'll get down here and we'll end up with the original configuration. So why do you worry about this? Well, guess what? There's drugs that will affect the function of some of these voltage-gated channel proteins. For example, we'll see that one that you and your patients are going to love, the local anesthetics. If you have to stitch somebody up, you're going to see that you can block that voltage-gated sodium channel. And guess what? That blocks depolarization. That blocks the painful message going down the neural pathway. You're going to like it because they're going to sit still while you sew them up. Here, this doesn't really fit any place, but I did give you a slide on this, right?
Yeah.
Okay, so it's easy to forget about how important sodium, potassium, chloride, calcium are, but we really need them for normal function throughout the body. And here's an example of clinical hyponatremia. And hypo means below, N-A-T-R-A, all of you have had, I was going to say scientific Greek and Latin, but you have medical terminology. That's the combining form for sodium. EM is blood, IA, so it's condition of low blood sodium. So your plasma sodium's too low. And think about all the different things we've talked about so far that sodium's involved with. So here's the case. This is actually was the father of a good friend of mine when I was in grad school. Older gentleman, he had mild to moderate heart and kidney impairment. Over the course of 2 days, he became increasingly disoriented, mentally sluggish, speech impairment, less and less responsive. His children, most of his children are physicians or in biomedical sciences, so they take him to the doctor, he's admitted to the hospital, and almost as soon as he's admitted to the hospital, he loses consciousness. So you think something like this, you think, Dad had a stroke. That's pretty common. Or, Dad bumped his head, has a slow brain bleed, maybe has a subdural hematoma. But what happened is, one of the first things that happens inside the emergency room, they take a blood sample, and very, very quickly it came back that, and they were doing a scan and so forth, so it was negative for stroke, negative for subdural hematoma. But what came back was his plasma sodium was 115. What should it be? 140, 150, it's 135 to 150 is normal. So he was way, way low. And guess what? That chemical concentration gradient for sodium, that helps drive those depolarization phases. So he had all sorts of things in his body starting to shut down, including his mental processes, because he didn't have enough sodium in circulation to drive those processes. This happened to my mother three years ago. It kind of happened about 6 weeks ago. Again, this is not unusual at all. You restore somebody's sodium and boom, it perked right back up. They're really, really good. We had a dental student who was just a third-year dental student who did a week-long rotation up to an oral surgery program, and the oral surgery residents had a patient that was really failing right after the surgery, and they were looking at all sorts of things, and the dental student who was years behind them in training just basically, he remembered this kind of thing. He just said, what's his plasma sodium? And here they were so worried about these other things, they just didn't look at the test, and there it was, low. And so they looked at it and go, whoa! And you know, within hours, the patient is conscious, he's doing well, and guess who was offered a position in that program, in that surgical program? He was. So he couldn't wait to get back to tell me about it. So Dr. Nick, he had hyponatremia. It was secondary to, he had some renal impairment, and gave him some sodium back, perks right up. And boy, that really happened with my mom too. My mom was down to 121. We thought she had a stroke.
So with this, what is the reason for low sodium? Is it low sodium intake?
There's so many different reasons. It could be low sodium intake. The most common is older patients that are on antihypertensive drugs. Clinicians will start stacking the drugs to more aggressively regulate their blood pressure. And something happens in their body, they have some other little additional challenge like an infection or something like that, and all those drugs, and boom, their sodium drops just like that. So, and you'll see that in a lot of things. The more intensively you manage a patient, the more chance you're trying to keep the top from being too high, but there's a chance of the bottom getting too low when some other problem happens. There's a lot of other ways of getting clinical hyponatremia. There's a term called water intoxication. So you can lose sodium, and that will cause hyponatremia, or you can take in too much water. And what does that do? That dilutes out the sodium you have. Sodium, a lot more in the extracellular fluid. When you drink a lot of water, it's going to dilute out that sodium. Here's a young woman who, just very, very sad situation. She was going to grad school in Boston, and I believe she was from Ecuador. From Ecuador. And I do remember when this happened. She had just completed her final oral defense for a doctoral program on Tuesday, and family came up from Ecuador. It was going to be a nice family vacation, and then the following Monday, she was going to run the Boston Marathon. And unfortunately, like a lot of people, now Andy, you're wearing a marathon. Did you marathon?
Half marathon.
Half marathon. Well, I'm half impressed. I'm just joking. But during marathons, it's surprising most people that overhydration is a far more common problem than becoming dehydrated. And that's what happened in her case. She was drinking too much water and she collapsed, and she died. And what happens is, what usually causes death is they get this brain and brainstem swelling. There's certain tissues in the brain that really hold on to their sodium. So if basically the water concentration in the extracellular fluid goes up, guess what? Water's going to go from high to low. It's going into the tissues of the brain, and because of the skull, there's no place for that swelling brain to go other than it gets pushed down the foramen magnum, and it causes transection of the brainstem. Really nothing you can do with that. So this is not an unusual thing. Hyponatremia, because of overwater consumption, is far more common, believe it or not, than dehydration. Other stupid ways of water intoxication is, I stopped collecting these when I got to like 14 cases across the country where, because of alcohol being banned from this campus or that, well, let's have somebody drink 2 gallons, 3 gallons, 5 gallons of water as some type of initiation ritual. Bottom line, you need to pick better friends. And so I just got sick, and so I just chose 3. But people drinking too much water too fast, and what happens? Brain swelling. And other things happen as well. But that's what really causes the terrible problems, because you get brainstem injury. Here's one that just way long time ago, when Nintendo Wii's first came out, I was one of the parents who would go out, stand in line in the middle of winter, try to get one for my kid for Christmas. Well, here, this woman, it was Hold Your Wee for a Wee. It was a wacky radio crew in Southern California. You know, what they had people do is drink a quart of water, I think it was, every 15 minutes. And the last person to have to run to the bathroom gets it. She makes it to second place. She doesn't get the Nintendo Wii. She gets a cranking headache, calls in to her boss going, I can't come into work this afternoon. She goes home, goes to bed. Her family comes home in the afternoon, she's dead. So, you know, don't do this.
How much is too much water?
Well, anything that would dilute your sodium down to 125, it's starting to get very, very dicey. So, of course, the amount would depend on the size of the person and their fluid compartments. Yeah. Now, none of you would know what this is. All sorts of different shapes and forms of ecstasy, methamphetamine, and this also causes water intoxication. And there's many, many, many case reports out there. And I didn't update this, but hyponatremia secondary to taking ecstasy or whatever. It's not called ecstasy anymore, but it's really methamphetamine. There's so many different types. But what happens? The cerebellar tonsillar herniation, that swelling and no place to go, and right there at the foramen magnum you can have that herniation and destruction of neural tissue. Now it turns out women are far more susceptible to this than men. I suppose if I went digging, it's probably understood now, but you know, this is something you're going to have to worry about clinically. And you go online, and unfortunately there's way too many pages that parents have set up because of their children dying, and you know, parents set up these sites to just try to let people know, stay off, you know, methamphetamine. What happens here is a perfect storm. Methamphetamine causes people to drink a lot of water. They're just constantly drinking. And at the same time, it causes this paradoxical release of anti-diuretic hormone. And what does that do? It causes your kidney to reclaim water from the filtrate and put it back in your bloodstream so you're not producing urine. So somebody's at an all-night rave and they're taking some meth and they're dancing and drinking water, maybe drinking this, that, the other thing, and this anti-diuretic hormone's being inappropriately released, and you get hyponatremia. Look at, here's a case study. It's females, males. You can see there's a lot more females than males. And this one right here, she wasn't female, she was a woman. I don't know what that's about. But you can see when they came in with some, 117 was sodium, 115, oh my gosh, that's incredibly low, leads to huge problems because so many processes in the body are chained to sodium. Sodium going down its concentration gradient drives transport process, drives polarization for action potentials. Bad things happen. So kids, stay off now. Okay, that's where we're going to get. Even happens in dogs. A few years ago, last couple years of the dog whisperer, Cesar, there was a dog that when they'd take the dog walking by a lake on a windy day and the waves would be lapping, the dog had this nervous run up and would bite the waves coming in. And the dog would then keel over. It turned out the dog was becoming hyponatremic. So, wow, the things you learn in physiology. Right? Sorry. Finish your off. And I will need to work with the office personnel how we get you your grades onto Moodle.